Good evening to everyone. Thank you so much for joining me this evening on tonight's health show. My name is Sulthana Ahmed. I am a GP right here working in Yorkshire. So we are back this week to talk about another health-related issue, and this week we are talking about a very important topic, stroke. It's also sometimes called a brain attack. Now, I just want you to take a moment and just think about, do you know what a stroke is? Do you actually know what is going on in your brain during a stroke? If somebody was sat in front of you, are you confident that you are able to recognize the symptoms of stroke and take appropriate action? It can be quite frightening, it can be quite scary, and sometimes people don't really believe what's happening in front of them. So today, we are going to try and clarify those questions if you don't already know the answers to them. I have with me a very special guest. His name is Dr. Andole. He is a stroke consultant, and he will be with me today to answer some of those questions. Thank you for joining me, Dr. Andole. How are you doing?
Sorry, Sultana, I can't hear you properly. I can't hear you. There's no audio. I can have a visual, but not the audio.
Okay, we'll just take 1 second to try and fix the audio on that. And once you can hear me, if you can let me know, then that would be great. Whilst we're just waiting for his audio to kick in, I'll tell you a little bit about stroke and how it is in the UK.
I can hear you all right.
Brilliant, excellent. So I was just going on to say that actually cerebrovascular disease, so diseases of the brain and its circulation, it's actually the 4th leading cause of death in the UK. So this isn't something that's rare, it's not something that's unusual, it's something that is very common. And you are a stroke consultant, you deal with it in your day-to-day. So if you would please tell us a little bit about yourself and what you do.
Right, okay. So I'm one of the stroke consultants and I work at King's College Hospital in London. And I'm also the medical director at the East of England Ambulance NHS Trust. And I also work as an improvement director for NHS England and Improvement. Wow. So on a day-to-day job, yes, I do look after strokes. And over the last 20 years or so, I've started looking after strokes. And you are absolutely right. Stroke was not the focus of attention of many public health campaigns in the past. And that was mainly because there wasn't anything else we can do with it. So people used to come with strokes and then you expect them to get better. If you do get better, you're lucky. If you don't, then you don't. And then half the beds in the hospitals, or at least quarter of beds in the hospital, were occupied with stroke patients. And then that was the recourse for most of the patients. But in the last course of 10 to 15 years, things have changed. Suddenly, stroke is one of those conditions which not only we can treat it, we can prevent it. The knowledge about stroke has increased considerably. So we can actually now reverse the stroke, or rather treat the stroke, get people better and give them as much better life as we can. And that is why we see so much of focus going on the stroke, because like many other conditions, like chronic conditions, once you have stroke, it's going to stay with you for a lifelong condition, and then you'll have to have there's lots of impact of stroke over economy, for the family, the emotions, how the whole family takes you with you. It's a huge impact, and that is the reason why. I guess that's why stroke is coming back into vogue as we're talking about it, so that what we can do about it.
Yeah. Okay, so what we are going to do today is we will try and outline what stroke is, what causes it. The most important segment probably will be the symptoms of stroke and how people can recognize it and what they need to do. So if we just strip it right back to the basics, so for the viewers who don't know, are you able to briefly describe what a stroke actually is? What happens in the brain when someone is having a stroke?
Yeah. Stroke is essentially a damage to the brain because of disruption of blood flow to the brain. That is what it is, the stroke. So depending on which part of the brain gets affected, you have those symptoms. The part of the brain that controls the symptoms you will have those symptoms. So there are two types of strokes because of a clot in the brain or clot in the blood vessels supplying that part of the brain. and that is about 85% of strokes. And about 15% of different type of strokes, there is a burst of blood vessel. But either both of them, the end result is the death of a brain tissue, and there is a damage to the brain, and that is what stroke is. Like I said to you, you talked about what are the symptoms of stroke next. So depending on where actually it affects in the brain, you get those symptoms.
Okay.
You have heard about the FAST campaign, which talks about the commonest. They are not by means the only ones, but you have noticed that those are the commonest symptoms of stroke. Where the FAST campaign talks about F being face droop on one side, A being arms, you're not able to keep it on one side because of the weakness of the arm, S meaning speech being slurred, and T, which means time to call 999. So that is the campaign that takes about the key symptoms of stroke, but the stroke symptoms are definitely not confined by itself. There are so many more symptoms depending again on which part of the brain gets affected.
Yeah. So you nicely described how the blood vessels to the brain can either become blocked or sometimes there's a bit of a bleed, which leads to a damage in whichever area of the brain is affected. And ultimately that leads to a loss of function of the affected area of the brain, whichever body part it controls. That's the body part where you won't be able to move, as you have said. So what would cause a blockage in the blood vessels of the brain?
Yeah, right. Okay. And I think it's the clot that goes into the blood vessel that supplies the brain. It can originate from any part of the human body, but commonly it originates from the heart. It can originate from the furring of the blood vessels that supply the brain, or it could be because of somewhere else, and sometimes because of the way the blood is. The blood is thick in few patients, and few people you have some blood disorders, blood dysfunctions that can cause you to have more likelihood of you having those clot formation is more likely in you, and then that is when the clot comes in. But either way, like we said, no matter what the cause is, the end result is the fact that the clot, when it does travel to the brain, that's what happens. Again, and that is why it depends. The treatment will depend. Although the treatment of stroke towards the end is what we're going to talk later on, I suppose. But it is more important when we are understanding the preventing the stroke. It is important to find out all these different things, because there's no one cause for the way the blood clot is formed and goes into the brain.
Yeah. And so you kind of talked about how a vessel can get furred up and get blocked. So what factors in someone's lifestyle will increase the chance of that blockage happening? So a lot of people understand that it's similar to someone who might have a heart attack, so high blood pressure, high cholesterol, things like that. Are you able to elaborate a little bit more on that?
Yeah. So you're right. I mean, so you've already set few, isn't it? You set the scene as it was. It's quite. I mean, so if I'd gone onto the street and asked somebody, what do you think are the things that the risk factors for heart attack, or probably many people in the country would tell me without a hesitation. But stroke is probably, they will have to think, but actually those are the same risk factors that causes exactly. Yeah. So you've already talked about the commonest things. You talked about diabetes, very common, more common in Blacks and Asian population, and that is the reason why it's twice as common than the native population. You find strokes in them. But having said that, let's focus on the diabetes, which is again more common in Blacks and Asians. And we also talked about hypertension, which is the high blood pressure, and especially the type of blood pressure when the type of stroke you get with high blood pressure is the burst of the blood vessels we talked about, not necessarily the clot. You talked about, I think you did say about high cholesterol as well.
Yeah.
There is a bit of influence as to what you eat that makes the cholesterol, but actually it is the way your blood is. Again, high cholesterol in the blood can cause you to have that increased risk of you having a clot. And of course, there are other factors such as smoking. Yeah. And again, the most important about all of this, Not that anything is less important, but most important would be the age itself. As you tend to get older, over the age of 70, the risk of stroke tends to get higher and higher. So those people will have the wear and tear in the blood, in the blood vessels itself can cause you to have those kind of clot.
Yeah, yeah. So brilliant. So I think the reason why I thought we would elaborate on those causes, like you said, actually later on when we talk about preventing strokes, we come back to those very factors. So you have described as how someone gets older, their vessels will start to wear and tear, become a bit harder, a bit more prone to damage. And then on top of that, if you have heart disease, conditions like diabetes, high blood pressure, high cholesterol, if you smoke and obese, all of those things impact on the integrity of the vessels supplying your brain, increasing the risk of stroke. So we are going to have a short break in just a moment. We have covered what a stroke is, what causes a stroke, and the type of lifestyle factors that will increase the chances of your stroke. We have already touched on some of the symptoms, but when we come back, we are going to be talking about what is it that you, as someone who has no medical knowledge or isn't medically trained, we are going to talk about the signs and symptoms that you need to look out for, that you need to recognize and be confident in knowing that this is a stroke and what I need to do. So we do have some questions set up for the second half, but as always, if you want to ring in, if you want to send a message, a question to our expert or to myself, we are more than happy to answer. The numbers are at the bottom of the screen and the landline is also available. Do remember the standard network rates apply. So when we come back, we will be talking about signs and symptoms. We will be talking about what you need to do. We will touch briefly on what the treatment for stroke is, but also what is it that you can do to reduce your chances of having a stroke in the future. So do come back and send in any questions, like I said. The other thing that Dr. Andole mentioned, which is very important, is that South Asians are affected. So please do come back for the second half and we will talk in more detail. See you soon. Assalamu alaikum everyone and welcome back to the Health Show. My name is Sulthana Ahmed and I am a GP. If you are just joining us today, we are talking about stroke. We have spent the first half talking about what is a stroke, what causes it, and I have a stroke consultant with me who is now going to elaborate further on the different types of signs and symptoms of stroke. Now, Dr. Andole, what I would say is when people hear about chest pain, it's quite easy for them to equate that with a heart attack because the location is in their chest. Whereas obviously, like you said, during a stroke, it's actually your brain that's affected, but people may not immediately relay that, you know, when they have their arm or face symptoms, that actually there's a brain issue going on here. So there may be a bit of a time delay for them to register that. So you mentioned a really good mnemonic fast, which I know has been on TV. It's been on, you know, buses and billboards to try and get people familiar with the symptoms of stroke. Are you able to go through that again for people who may not have heard it the first time or who may have already forgotten or not quite caught it?
Right. The FAST campaign is FAST. F stands for face. When the face is fallen on one side, A is arms. A stands for arms. And when you keep both arms in front of you, and if you're not able to hold it there because of weakness of one side of the body or arm, it drops down. So that is the arms. S is for speech. When there is a speech that is slurred or kind of different to what it normally sounds. And T is the time to act, time to call 999. And I think the key bit here I would say is, I think you've emphasized it, but maybe I'll come at it at a different angle. Stroke is a medical emergency.
Yeah.
Just like heart attack, stroke is a medical emergency, and it is important that you do take the patient to the hospital straight away. because time is absolutely critical. The sooner you get into the hospital, the better, or the more likelihood of you getting better, and the more you're eligible for all the urgent treatment that you can get in there. So I think it is important that recognition is an important aspect of stroke, but you need to recognize it both as in general population as well as in the hospital itself.
Yeah.
But not only recognition, but when you do recognize, you need to act on it.
Yeah.
Which is about the second element of it.
Yeah. So the face, arms, and the kind of speech and sometimes swallow as well, people say that they are the most common symptoms. Now, there are obviously other symptoms of stroke. So if your relative or friend who you suspect is having a stroke has additional symptoms, that doesn't necessarily mean it's not a stroke. It's just that, like the specialist has said, there are different brain parts that are affected, and so they can have different symptoms. Without trying to overwhelm people, I think it's important to just touch on what other type of symptoms people may have. Are you able to go through that with us today?
Yeah. And I think I kind of right at the start, I did say that depending on the type of, depending on the part of the brain that gets involved, you're going to get those symptoms. So let's look at in no particular order, but let's look at the fact that if it affects the back side of the brain, if you get the back side of the brain, that is important in your balance, in your speech, in your swallowing, in your breathing, and able to walk in a straight line as it was, you're not able to balance yourself properly. So that could be one symptom on its own. The other common symptoms people talk about is the vision itself. When you actually have a blurring of vision, it's it is like more like a curtain falling in front of your eyes. That is another symptom of it. And of course, there are lots of people come in who don't have any problem with the face, speech, or the eyes. It's just the weakness of one part of the body.
Yeah.
Sometimes it could be just the leg and arm on one side, or it could be just the one bit, just the leg or the arm in itself.
Yeah.
Quite rare, but it is still possible that those can be another thing. And sometimes more when it affects the higher level of the brain, there can be problems with the memory, recall of the facts itself. And it's sometimes you can just lose a temporary loss of memory, or you may actually forget what might have happened in that time and during that phase of when you had the stroke or damage to the brain. So these are few of those.
Yeah.
But again, like I said to you, these are not exclusive. There are so many more symptoms. Yeah. The numbness, tinglingness across the body and on the face. This is another symptom. And there can be other symptoms depending again. Again, they don't want to overwhelm, like you said, but there are lots of other symptoms as well. Yes.
Yeah. So if you suspect a stroke, as Dr. Andole has said, it's a medical emergency. The doctors would expect you to call 999. If for whatever reason you're unsure, the symptoms are a bit vague, the person appears well, we wouldn't expect you to make that decision and diagnosis on your own. At least do pick up the phone and call 111 to get some advice. And if they suspect a stroke based on the symptoms that you are describing, then they will send paramedics to your house immediately. So just the last two questions that we are going to cover. So when someone is taken to the hospital with a suspected stroke, what can they expect? What type of tests or treatments? Because you said now there's lots of different options.
Indeed. So when you have a stroke and when you have a symptom suggestive of stroke, as soon as you get into a hospital, you get screened for that. And then the first step of the investigation is a CT scan of the head. So you've been taken straight into the scanner where you have a CT scan that recognizes if there is any damage to the brain, especially it looks at if there is any leakage of blood within the brain tissue itself. So it will tell us straight away. It's a test which can be done within 5 minutes. Yeah. You just enter into a donut and you come out and you're done. Essentially as simple as that.
Yeah.
And depending on what actually you see on the CT scan, and if what you don't see as it was, and if there is no bleed, you may be eligible for a clot busting treatment, which is called thrombolysis. clot busting treatment is most effective if you give, well, it is effective only if you give them within 4.5 hours after the onset of symptoms.
Yeah.
So you get the clot busting treatment, and depending on where the location of clot is, over the last several years, the new technology that has come in treatment of stroke is the thrombectomy, which is actually putting in a tube right from the groin and going right up to the brain and trying to pull that clot out of the brain, where actually it is obstructing the blood flow to the brain. So try and pull out the clot itself. So those are broadly different areas of treatment. Of course, it doesn't mean that everybody who comes into the symptoms will have all those treatments.
Yeah.
But it is one of those things that we do it more and more. It's becoming more and more common.
Yeah. Yeah. So we are actually nearing the end of this show. We've got about 4 minutes left now. And this last segment, I just wanted to focus on what is it that a person can do to reduce their chances of having a stroke. So we touched on the causes earlier. As a stroke consultant, when someone comes in of a suspected stroke or high risk of stroke, what type of advice do you give to your patients to reduce either recurrence or from it happening at all?
Right. The first bit is that if you actually had a stroke, there are lots of tests that you can get it done. We haven't talked about there is a irregular heartbeat, a specific kind of problems with the heartbeat itself, which is called atrial fibrillation. If you do diagnose it, and then there, if by giving you the right medication, you can prevent the clots forming again and again. So that would be a big part of stroke prevention itself.
Mm-hmm.
Having said that, all the risk factors, what we talked about in the past, high cholesterol, blood pressure, diabetes, all those risk factors, and overweight, the type of food you eat, smoking, all these factors, it's all about how do we manage those risk factors itself is a critical one. It's important that those risk factors are taken into consideration and see what is it we need to, how do we keep a lid on it or control it better as it was.
Yeah.
There are few more small other treatments that are available for stroke apart from medication, which is small, and there are treatments that will be only eligible for few group of patients, which is like carotid endarterectomy, which is like a small nick in the neck of the vein, neck of the arteries in the patient, where you can actually dilate the blood vessels and improve the blood flow to the brain itself. So there are a few other things that we can do. But essentially, it is about monitoring those risk factors to be able to look after yourself well.
So one question that we've been sent in by a viewer is, very quickly, does COVID increase your chances of having a stroke?
Well, it is, isn't it? But there already been lots of research now, and there is evidence out there to say that COVID increases the clots in the circulation itself, and there seems to be a very, very small increase of risk of strokes because of COVID itself. And it doesn't seem to be significant, but it is still there. So the answer to that question is yes, it is. But I think the more risk, the bigger risk for patients who have had stroke is delaying the treatment coming into hospitals is much more than actually a small risk of COVID causing you to have a clot in the circulation. Yes.
Dr. Andole, I'm afraid that's all we have time for today. That's gone by really quickly. I would like to say thank you for joining us today. And the main take-home message from today's show is stroke is a medical emergency. Please be aware of the fast symptoms. And if you suspect a stroke, do call 999. There'll be loads of questions that many of you have about what you can do to prevent a stroke. More information is always available. So you can go on the nhsinform website for more information. And there is also the stroke.org website as well, which has more information. We hope you have enjoyed this week's show and that you have found it informative. I will, inshallah, be back next week to discuss more common topics. Thank you to the questions that you have sent in. Unfortunately, we haven't really been able to go through all of them today. If you have any suggestions about what you would like to see in the future, we are more than happy to receive your comments, queries on the numbers below on the screen. My name is Dr. Ahmed, and inshallah, I will see you next week on The Health Show. Take care, everyone. Have a good evening.